Hi, I'm Alexa DiAnna.
I'm Sarah Sisk.
And I'm Rachael Wilson.
And our project is on donation after cardiac death.
Did you see the horrible accident on the news last night?
Yeah, I did.
Oh, that poor girl. I would never want to be on life support.
Me neither.
But it's really great that she's donating her organs. If I was in her situation, I would want to do that too.
Mrs. Jones, have you made the decision to withdraw life support yet?
Yes, I know that's what Pearl would want. She doesn't want to be on life support.
Okay, have you heard about organ donation after cardiac death?
No, what is that?
Cardiac death is an irreversible cessation of circulatory and respiratory function, resulting in ventilator dependency, but not fulfilling brain death criteria.
Wait, is she brain dead?
No, brain death is an irreversible loss of functions of the brain and brainstem. This includes coma, absence of brainstem reflexes, and apnea. Donation after cardiac death can be controlled and uncontrolled. Pearl is going to be a controlled donation after cardiac death because her withdrawal of life support is predetermined, and an uncontrolled donation after cardiac death entails an unanticipated cardiopulmonary arrest and/or failed resuscitation.
Okay, so what organs can Pearl donate?
She can donate her liver, her kidneys, and her pancreas.
Mm-hmm.
There have also been successful transplants with hearts and lungs.
Yeah, that sounds like a good idea. She told me that she wanted to donate her organs to someone in need.
Okay, we'll go get the consent form, and you can sign it to give permission, okay?
Yeah, I'm her legal decision maker, so I'll sign it.
Okay, I'll go get it.
Nurse Alexa, how did you know Pearl was a good candidate for organ donation after cardiac death?
Well, Pearl's cardiopulmonary function will likely not resume after the withdrawal of the life support.
But what if she doesn't die?
If she doesn't die within 60 minutes, we will not take out her organs, and we will bring her back to the ICU for further care.
How will you know if she's dead or not?
I will be unresponsive, have no pulse or cardiac sounds, and no spontaneous respirations.
Okay, how long does the organ procurement take?
Well, after we withdraw the life support, we have to wait 2 to 5 minutes to make sure that she is dead, and then it will take 1 to 2 hours to take out her organs.
Okay, that sounds good. Can I have some time with her before you take her off to the procedure?
Of course, you can have as much time as you need.
Okay.
I'm going to go get her some medications that she needs before the procedure, though.
Okay, that sounds
I'll be back.
Oh, Pearl, I'm going to miss you so much. We were the best sisters.
Okay, I have those medications that I need to give her.
Okay, what type of medications are they?
Okay, I'm going to give her some morphine, ventolamine, and heparin. These are going to help preserve her organs before we harvest them, and it's going to make sure she's not feeling any pain for any of this procedure.
Okay.
Is that okay?
That sounds good. I'm ready for you to give her the meds and take her off life support.
Okay.
There are many different outcomes for recipients of donation after cardiac death organs. Graft failure in the first 3 months after transplantation is twice as likely in recipients of DCD kidneys as compared to the recipients of donation after brain death kidneys.
However, there is a 56% reduction in mortality in DCD recipients versus patients continuing dialysis and waiting for a DBD transplant.
Recipients of DCD livers have a lower 1 and 3 year survival rate and a higher retransplantation rate than recipients of DBD livers.
For DCD lung transplants, each hour increase in cold ischemia time increases graft failure rate by 6%.
And for lung transplants, there is no significant difference in post-transplant survival in DCD and DBD recipients.
There are also many ethical concerns for donation after cardiac death. Opponents of DCD claim that it violates the dead donor rule, which states that donors must be dead before vital organs can be procured, and living patients should not be killed by or for organ procurement.
There are also concerns that there is a lack of respect and loss of dignity of the dying process for potential DCD donors and their families.
Opponents of DCD claim that preparation and interventions prior to withdrawal of life support provide no benefit to the donor, and therefore only serve to preserve their organs and hasten death.
Opponents also believe that transplant teams are trying to meet a supply and demand and may be financially profitable, so there may be pressure for patient families and healthcare providers to terminate treatment in order to procure organs.